All right, I'm going to attempt to bring this crowd to order. There's a rough crowd tonight. I think you all have too much fun. So I'd like to welcome everybody here on behalf of the National Academy of Social Insurance. I am the president of the Academy for about 24 more hours. So there is life after the Academy. So we're here tonight to honor Karen Davis for her outstanding contributions in the field of social insurance, and particularly in the area of Medicare. And we have a great program ahead of us, including the high privilege of being able to be present to hear Karen speak and give us her views, a lifetime of thinking about the future of Medicare. So I think this is going to be a very interesting evening. But before we get started, I've been told that I have to make some announcements. One of the functions of being president of the Academy is knowing how to do what you're told. So I'd like to thank the many people who made this event possible. The event committee, led by our co-chairs, David Blumenthal and Karen Ignani, and then Henry Aaron and Glenn Steele, who will share their thoughts about the impact of Karen's work with us this evening. Our institutional sponsors, who are all listed in your program, and they're also flashing up here on the monitors. But many of tonight's top sponsors also support the Academy's other activities in Medicare and healthcare, including Anthem, the Commonwealth Fund, AHIP, America's Health Insurance Plans, Merck, the Peter G. Peterson Foundation, the California Healthcare Foundation, and of course, the Robert Wood Johnson Foundation. And also we have many, many individual sponsors, and you'll see those in your program, and I thank each and every one of you for your generosity. And finally, I'd like to thank the great team at the Academy that has really worked behind the scenes to get everything together tonight. So if we can give a hand to all those who worked to do this, thank you. So I think the Academy is an exercise in doing great things with very little labor, and we have people who work very hard to make all this happen. I also want to just make a few comments about the Academy's celebration of the 50th anniversary of the Medicare and Medicaid programs. It's interesting that I just went back a couple of weekends ago for my 50th high school reunion, and it made me realize how old Medicare really is. But on the anniversary of these two great programs, we look back at many of the lessons we've learned over the past 50 years, but really more importantly, we look ahead at the challenges that we face coming in the years ahead. And the Academy has had a really fantastic series of programs that have just begun. We have more coming that have focused on a lot of the different issues and challenges in the Medicare program, but really more importantly, creating an inspiring sense about where we can really go with these great programs that provide so much to to Americans who need health care, but also are such a major part of our economy. So I hope you'll be able to join us for these programs throughout the summer and into the fall. Look on our website because we have a whole list of things that we're doing, but I think you'll agree that the Academy has just been front and center in terms of taking the opportunity to celebrate what we've achieved with these programs. So, and again, I'd like to thank all of you here tonight for your support for the Academy and for coming tonight to this event. So, when I look around the room, I don't know, is this one of these things where we have a tornado coming and we can either choose to blow up with it or sit here and eat our dinner in peace? Pay no attention to the emergency. The last time I heard that, by the way, was over the loudspeaker system in the hotel across the street from the World Trade Center the morning of 9/11. So I don't know if that's a good thing to ignore. So I just want to say, looking around this room, at what I see as an unusual assemblage of experience, talent, and wisdom. This is a vast resource for the National Academy of Social Insurance. And today we have the real honor and privilege of honoring one of the leading lights in our array of stars in the National Academy's membership. But, you know, people always talk about how when you look at an array of talent like this, only Jefferson could have done better dining alone, but it wouldn't have had nearly as much fun as we're going to have tonight. But this is a resource that the Academy needs to use more extensively and effectively, and will be using more extensively and effectively in the years to come. And it's been my privilege to have been asked to serve for 3 years as the president of this Academy. And it's been challenging times, to say the least, particularly with the change in the way foundations go about funding their activities. They're changing in their priorities and practices. But we have a lot of new, exciting new directions underway at the Academy. We have a very bright future ahead. And I really encourage you to stay tuned and watch for what's coming in the next year and a half and 2 years, because I think you'll be excited about it and want to be involved in it, and I hope that you will. So it's my honor tonight to introduce 3 people who need no introduction. So some of you might think, well, good, well, then maybe he'll sit down and we can get on with the show. But to start with, I think someone that clearly needs no introduction to the Academy membership, Honoree Aaron. And I'll just note very quickly that Honoree chairs the Social Security Advisory Board and the DC Health Insurance Exchange, so he plays it on both the public and the private side of the ledger. Pay no attention to the thunder and lightning out there. He is at the Brookings Institution. He has been a leading light in policy work in this area for a very long time, and it is with great pleasure that I introduce Honoree.
Thank you very much, Larry. When I was asked to say a few words about Karen Davis and why she deserves the Bob Ball Prize, I did something that many of you might do. I went to Wikipedia. You say you wouldn't do that? Well, I did, because I know from personal experience that Wikipedia finds things no one else knows about people. How do I know this? Well, because of what Wikipedia wrote about me. The following entry, and I promise you I am not making this up, appeared on March 27th, 2014. Henry Jacob Aaron, born 1936, is an American economist and healthcare expert who works at the Brookings Institution. He is a member of the Institute of Medicine and the American Academy of Arts and Sciences. He is credited with writing all of Shakespeare's plays and is often considered the founder of Christianity, Judaism, Islam, and Nubianism, which you may not have heard of but really exists. He is also the real identity of Barack Obama, Jackie Robinson, Friedrich Nietzsche, and John Harvard. I regret to say this entry was taken down after 8 days, but not for the right reason, because they had entirely missed my sensational career in baseball. But I digress. What, I wondered, would Wikipedia have to say about Karen? Well, Karen Davis, it seems, is an animal rights activist, a messianic music singer, a fictional character from the Grudge film series, the former mayor of Glendora, California, a neuroscience professor at the University of Toronto, head of the LAPD Homicide Department, and incidentally, president of the Commonwealth Foundation. Wikipedia erred again, of course, by listing these achievements under separate entries, but no one's perfect. So let's leave Wikipedia out of it and simply look at what you and I know that Karen Davis has done, which, as it happens, fully explains why she is a superlative selection for a prize named for Bob Ball, one of the most respected advocates of social insurance. The criteria for the Ball Prize states that the candidate should have, and this is a quote, changed, educated about, or otherwise furthered public understanding and informed policymaking on social insurance, and been effective in deepening public understanding, fostering collaboration, informing policy, implementing policy, or teaching others about social insurance. Now, I think that's a pretty good description of Karen's career. She has deepened public understanding through her research on virtually every aspect of health care policy, public and private. By her writing of books and hundreds of articles, and by her countless talks and speeches. She has fostered collaboration on numerous boards, advisory committees, commissions, and you name it, where she has served and continues to serve. And if you want to get a flavor of what academic cooperation is, check out her bibliography, where collaboration is everywhere in evidence. Karen was a tough manager and probably still is, but she has elicited loyalty from those who worked for and with her. Kathy Shane, whom I first met at Brookings as a research assistant, she was, I wasn't. Stuart Gutterman, Jerry Anderson, Sarah Collins, Diana Rowland, and many others whom I am unintentionally offending by not naming them. They've all been Karen's professional partners, each over many years, and all have made distinguished careers of their own. The award Karen is receiving today is in many ways an award to Karen Davis Incorporated, to the splendid team of analysts and advocates whom she supported and who support her. She has informed policy as an advisor to the Congressional Budget Office, elected officials, hospitals, and others in appointed government positions and through congressional testimonies so numerous that one might suppose, unless one knew better, that members of Congress are slow learners. She has implemented health policy as an administrator at the Health Resources Administration. She has taught others about social insurance in classrooms at Harvard and Johns Hopkins. And I haven't mentioned the service for which many here may know her best, her 20 years at the Commonwealth Fund, first as executive vice president and then as president. I met Karen first when we were both on the staff at Brookings. When I was invited to go to the Office for Planning and Evaluation at what was then called the Department of Health, Education, and Welfare, I thought I knew something about welfare and maybe about education, but I realized that I knew absolutely nothing about the health part. So I asked Karen to come and be the deputy for health. To understate matters really quite greatly, that was a sound decision for both a negative and a positive reason. The negative reason was that I really did know nothing about health policy, and the positive reason, of course, was that Karen knew a whole lot. She did a great job, and more responsibility was sent her way. She has always been driven by a relentless commitment to promote policies that help those who lack the means to help themselves. That is a commitment that she shares with the man for whom the prize she is receiving today is named. So, bravo to Karen for a career that has mattered, and bravo to NACI for having the good judgment to recognize her and her achievements.
So now I'd like to introduce Janet Scheichels, who's going to introduce Glenn Steele. And I'll just say about Janet that, because we all know her, and she's an active member of the Academy, and she's been involved in some of our study panels and chaired our conference and other things, that she was at GAO at one time running their Health, Education, and Human Services Division, and she has been at, worked on a Commonwealth task force, so I'm sure that she had a lot of contact with Karen in the context of that. And so she is a stellar member of our Academy. So Janet?
So it's my pleasure, great pleasure, to introduce Dr. Glenn Steele, who is just stepping down as CEO and president of the Geisinger Health System and is currently chair of the board of XG Health Solutions. And it's particularly fitting, I think, that Glenn has a chance tonight to speak about why Karen is so deserving of this honor. Glenn and Karen met probably, I'm thinking, 14 years ago. And they quickly figured out that they shared a same vision of how to improve the efficiency and quality of healthcare through innovation. So then Glenn worked with Karen to help her on the commission, at the Commonwealth Commission on the High Performance Healthcare System. And Karen has been a very active member of the Geisinger Board, helping to promote its innovation experiments. So it's been a terrific partnership over these past years. Dr. Steele.
Well, first of all, there are two reasons why I feel honored to be here. One is obviously Karen, and the other is that I went on Wikipedia and I thought, what a wonderful thing that I'm going to be able to meet Henry Aaron. Now, I have to say I was a little disappointed when I saw him. I'm sorry, Henry, but knowing that you did all of Shakespeare actually makes up for the other disappointments. So just to set the context of all this, I actually worked for Karen in two venues. Now just think about that for a minute, for all of you who have ever worked for Karen. So Karen was my boss in two venues. One was the Commission on a High-Performing Health System, and the other, obviously, she was on the board of Geisinger. And that, that has an upside and a downside. And we'll talk about that in just a minute. I'm delighted to be asked to celebrate Karen, both her career and Karen as a person. My interaction started with her, I think, through David Blumenthal kind of insinuating me into the Commonwealth Fund studies prior to the initiation of the commission. And I, my imprimatur was obviously Geisinger at a time when it was coming off of a very difficult period in its life cycle. And as it started to build its brand recognition, as it started to do a lot of interesting real-life tests on higher quality at lower cost, it became an intriguing model. And part of that, I think, was the reason why I became associated with the Commonwealth Fund. And the inception of the Commission on a High-Performing Health System was really an amazing confluence of talent, of Karen's leadership, of her mission-driven commitment, and of course, also of the external context. And I think having gone on that commission, and I've seen a number of members here, under Karen's leadership and with David and other colleagues, and I think I started there around 2004, 2005. That was really one of the most amazing experiences because a huge amount of what we noodled about and what we argued about and what we wrote about actually was incorporated in PPACA. And I'm very proud of that, extraordinarily proud of that. And it also helped to formulate what we were doing at Geisinger. And so, since I believe most of life is transactional, when Karen was able to get me involved in the commission, the quid pro quo was I insisted that she get involved in Geisinger, and she joined the Geisinger board in 2004, just at the point where we were building our national brand. And she joined our insurance boards in 2010, so she's on both sides of the house. In both venues, what I experienced was an amazing combination of Karen's ethical commitment plus her economic rationality. And that's an amazing combination, ethical commitment and economic rationality. And she was calm, she was persistent, she was intelligent, intrepid in her leadership, and she helped us create a remarkable set of rules, recommendations and examples for how we could begin to go from where we are now to where we want to be in both providing care and paying for care. The other thing I have to say is that Karen, in becoming a Geisinger Foundation board member, once again was precedent setting. Karen was the first female board member at Geisinger since Abigail Geisinger founded us in 1915. And I can guarantee you she was without a doubt the first liberal board member that Geisinger has ever had. So we had a twofer in diversity, and you know, our work, I think for the commission, our work products obviously speak for themselves. I think again, you know, we're on a journey with a fundamental conversation about both capacities as well as incentives, moving us from, you know, piece rate care to payment for integrated care and beginnings of payment for value. For Geisinger, what Karen did was advocate for and help me spread the gospel of unlocking value by removing as much of that 35 to 45% of costs that really didn't bring value to the people we served or actually could hurt them. And with that emancipated value, we could easily afford, both as a society and as Geisinger, to expand our commitment to offer insurance to a wider, needier, higher risk population. So for all of that, Karen, I thank you. I can think of no one more appropriate to receive the Bob Ball Award, and it's been a privilege to work for you and work with you over these years. Thank you very much.
So now I'd like to introduce David Blumenthal, who will introduce Karen, and we're all waiting to hear from Karen. And David is her successor at the Commonwealth Fund, is the president of the Commonwealth Fund, and he has been a professor at the Harvard Medical School. He served a stint in government as the coordinator of the Office of the Office of the National Coordinator for Health Information Technology, and he has been a chair of one of NACI's study panels in the past, and a very illustrious member of our academy. Thank you, David.
Well, I didn't read Wikipedia before I came here. I think if Wikipedia were publicly traded, the analysts would be very pleased to hear all its citations this evening. Glenn and Henry have done a marvelous job of introducing Karen. I'm going to add very little to what they said. I am going to say a little bit, though, about when I first got to know Karen's work, which was during medical school. I used to sneak away from my colleagues to this very small library on health policy that existed at Harvard Medical School. It was a secret, really, well-kept secret. And it was there that I encountered her book on national health insurance. So I read the book, and I was therefore well prepared to meet her, which I did when I worked for late Senator Edward Kennedy, and she was working for Henry. And it was while at some hearing or some event on Capitol Hill, and I was enormously impressed to meet her and to see the person who had written this incredibly clear and to me, enlightening book about national health insurance, its rationale, the role of markets in healthcare, and so many things that have continued to preoccupy me ever since. So I'm one of the people who was deeply influenced by her work, was privileged to meet her. Now I have the incredible challenge of trying to fill her shoes, and I, as a result, have come to know firsthand her work in a different way, the vision that she brought to the Commonwealth Fund, her skill as a tactician and as a setter of directions for a philanthropy, and how she has fulfilled the mission laid down by the founders of the Commonwealth Fund, the Harkness family, specifically Anna Harkness. I think the first woman ever to found a philanthropy in 1918, to serve the mission of doing something for the common good. The Harknesses believed that charitable giving should take a long-term perspective, and Karen's leadership has fulfilled that purpose in many ways. The ability of the fund to be relevant to the Affordable Care Act recognized work that had been going on for many, many years. It was not a short-term effort. It represented the Foundation's commitment to social progress, and it showed Karen's dedication to high-quality scientific work, to excellence in grant-making, to a focus on results, driven by her natural ability to mobilize talented people and to seek out and partner with those who share her concerns and her expertise, like the Academy. By focusing at the fund and over her entire career on issues like affordable, high-quality health insurance for all, healthcare quality improvement, innovation in long-term care, better primary care, and importantly, on communicating what the fund's work found. Karen has really embodied the criteria for this award, which of course honors people for deepening public understanding, fostering collaboration, informing policy, implementing policy, and teaching others about social insurance. The list of other honors that Karen has received goes on at great length. The communities that have recognized her include health services research, hospital community, the quality measurement community, health economics community, the academic community, the philanthropic community. And she has consistently been ranked as one of the top 25 women in healthcare and among the 100 most influential people by modern healthcare. I'm told that at the beginning of her presidency, Karen introduced her philosophy at the Commonwealth Fund as a commitment to continuous improvement and continuous change, a constant search for ways of doing things better. She defined foundation work as a special trust and asked that the staff be accessible to others and open to ideas, responsive and helpful to all who sought advice and guidance from the foundation, from the fund. For her leadership in driving the United States toward a higher performing health system and her tireless commitment and passion to promoting the common good, she is every bit the appropriate recipient of this year's Robert M. Ball Award. And I invite her to the podium.
Thank you. I'm so touched by these introductions and remarks, and so touched by having all of you here, sponsors, friends, people who share a common mission, a common purpose, and that is to ensure that our nation's social insurance programs are there to provide health and economic security for our nation's most vulnerable people, the elderly, the disabled, and the poor. And it's hard to imagine what life would be like in this country without Social Security, Medicare, and Medicaid. So it's a particular honor to receive the Robert M. Ball Award on this, the 50th anniversary of Medicare and Medicaid. I first came to Washington to work for Bob Ball as a Brookings Economic Policy Fellow under the tutelage of Dorothy Rice, who headed the Medicare Research Office at Social Security. And Bob was just an extraordinary leader, and everyone at the Social Security Administration was energized by his vision, his commitment to social insurance, his commitment to ensuring retirement with dignity, and for some of us who watched him testify before Congress, his amazing ability to make every senator look brilliant. But it was really SSA research over 50 years ago that documented that half of the elderly were uninsured, threatening not just the financial security of the elderly, but their children as well, who often used up their savings helping their parents obtain health care. So think about half of people being uninsured. Today, only 2% of the elderly are uninsured, and what a dramatic difference that has made. And the percent of healthcare expenses that are paid directly out of pocket has dropped from 56% to 13%. And the nation's elderly are living 5 years longer than they did when Medicare was enacted. It's also an honor to follow other Robert M. Ball awardees, including last year's awardee, Marilyn Moon, good friends here this evening, John Rother, I messed up your name, John Rother, and Bruce Vladeck, and particularly my former Brookings colleagues, including Henry Aaron, who you heard gave me the opportunity to serve at HEW in the Carter administration, Bob Reischauer, who's been a friend and inspiration over the years, and Alice Rivlin, my early mentor at Brookings, from whom I've learned so much. So I'm touched to be in their company. I'd also like to thank and congratulate Pam Larson on her leadership at the Academy. She's had the vision, energy, and leadership skill to position the Academy as a major contributor to the nation's thinking on social insurance. It's been a critical force in meeting 21st century challenges. It has done so much to increase public understanding of how social insurance contributes to economic and health security. So I thank her and her colleagues for those pioneering efforts. This is a time, as we all know, of momentous import with regard to the direction our nation's healthcare system will take. For 50 years, Medicare and Medicaid have improved health insurance coverage, ensured access to health care, reduced disparities in care across racial and economic divides, provided financial protection against the hardship of medical bills, and helped advance innovation in healthcare delivery to meet the needs of the most vulnerable. But for those of you who know me, I don't spend much time looking back. It's always, what's the next challenge ahead? And I think we all agree that Medicare faces major challenges in the years ahead that will require all of the expertise and dedication in this room and beyond. Boomers born after World War II started entering Medicare in 2011. And by the turn of the next decade, they will be in their 70s and begin to confront the vicissitudes of aging as they look at the experience of their parents, friends, and themselves. Medicare will need to adapt to meet their changing needs and preferences for being productive and independent as long as possible. We've heard a lot about the greatest generation, the generation that grew up in the Depression and served our nation in World War II. Franklin Delano Roosevelt is the leader who brought economic security to the elderly and disabled through enactment of Social Security in 1935. In my view, the generation that followed the greatest generation is the social justice generation. They helped end segregation, by joining civil rights marches leading to enactment of the Civil Rights Act in 1964. They embraced John F. Kennedy's War on Poverty, one of my favorite photos with John Kennedy Jr. You've seen flash before you at the what would have been the 80th birthday of President John F. Kennedy at the Kennedy School on a session on Medicare, where I really learned a lot about how much Kennedy was committed to getting Medicare enacted. And obviously Lyndon Baines Johnson, Great Society, with the enactment of Medicare and Medicaid in 1965, which today provides health insurance, access to care, and health security to over 100 million people. Medicare had an immediate impact on access to care and reducing disparities in care by requiring hospitals to be in compliance with the Civil Rights Act. Carol Estes is here. If her colleague Phil Lee were with us this evening, he would say that was the single greatest accomplishment of Medicare, leading to the immediate desegregation of hospitals since it was a condition of receiving Medicare funding. The social justice generation also changed the opportunities for women, opening up education and jobs as part of the women's movement. Women entered the labor force and the professions such as medicine and law in large numbers, and they took to heart the theme of the book, Our Bodies, Ourselves, and were no longer willing to leave decisions central to their well-being to others. And as this social justice generation enrolls in Medicare, I am sure that they will encounter much that needs to be changed and set about changing it. And high on that list will be changing Medicare to support independent living as Medicare beneficiaries age and need assistance in their daily lives. You've heard it. So, we know who led that round of applause. And I've been very moved by Dr. Atul Gawande's book, Being Mortal, which eloquently documents the gulf between the way in which Americans age and die and what they most prefer. We pour enormous sums of money into extending life by even a few days or a few months, as Atul talks about with chemotherapy, surgery, and intensive care, while at the same time failing to support families and friends trying to care for each other in their homes and communities, whether that is palliative care at home, personal care services for those no longer able to function without assistance, home modification or supportive housing that's easier to navigate, or support for family caregivers to help those with complex needs be safe and cared for in a familiar setting while continuing independently to make the day-to-day decisions that make life meaningful and enjoyable. As Atul writes, we think our job is to ensure health and survival, but really it is larger than that. It is to enable well-being. Marilyn Moon and I, along with colleagues from the Robert C. Lipitz Center, who are here this evening, the Lipitz Center on Integrated Healthcare at the Johns Hopkins Bloomberg School of Public Health, recently completed an analysis for the Commonwealth Fund of Medicare beneficiaries with complex care needs. And we define those as beneficiaries with substantial physical or cognitive impairments, measured, for example, by 2 or more limitations of activities of daily living. For those of you who are into it, I've learned about cognitive impairment summary scores of less than 21, or a diagnosis of Alzheimer's, we all know what that is, or other dementia. And there are 17% of Medicare beneficiaries today, 9 million people who live at home or in the community who need assistance carrying out their daily lives. And only 30% of these beneficiaries are covered by both Medicare and Medicaid. So it's not an issue of the duals. That's only 30% of this population. only 30% that may have access to home and community services from Medicaid that support them in independent living. But the proportion of complex care needs beneficiaries who are below 200% of the poverty line but not covered by Medicaid is 32%. And this is the group most at risk of being unable to afford to pay for home and community services directly out of pocket, exhausting their limited savings, and entering a nursing home where they can, in a short period of time, qualify for Medicaid. Using data from 2010, Medicare's mean payment for complex care needs beneficiaries is more than twice the mean payment for non-complex care beneficiaries. Out-of-pocket spending is also higher for this population. The average annual out-of-pocket healthcare spending for complex care needs beneficiaries was 17% of income, compared with 7% for other beneficiaries. And for those complex needs beneficiaries with incomes below 200% of the poverty level but not covered by Medicaid, it's a startling 39% of their household income that is spent out of pocket on healthcare expenses. So I would say that one of the major challenges facing Medicare in the future is how to redesign its benefits to provide home and community care services, such as personal care, home modification, senior daycare, training and support for caregivers. And the rationale is clear and threefold. The cost of such services represents a major financial burden on modest income beneficiaries. Second, without better support in the home, complex care beneficiaries are more likely to require long-term institutional care, qualifying for Medicaid, and increasing long-run federal and state Medicaid expenditures. And third, all Medicare beneficiaries with complex needs can benefit from knowing where to find reliable, high-quality, coordinated home and community services tailored to fit their needs and circumstances. So since this is a room filled with experts, many of whom know a lot more about this issue than I do, I certainly concede that there are a number of issues to be addressed in how to do this well. But I also believe there is a lot to be learned from successful innovations across the US and around the world. Some of you know that Denmark is one of my favorite countries, so I'm always talking about what the Danes have done in IT and in primary care. But they made a major commitment to home care and preventing nursing home placement in 1987. And they froze nursing home construction and instead established group practices of salaried nurses and nurses' aides in every community to provide services to elderly and disabled beneficiaries in their homes and expanded supportive housing options. One of the great things about being at Hopkins are all the wonderful students we have, and one of my graduate students had been working in Ontario on a home care report and sent it to me. And it starts with their guiding principles, and it says, everyone who has needs that can be reasonably met in the home or community will receive support to do so. So can't you just wait to read a US policy document that says that? The Commonwealth Fund recently put out a report on the Dutch system that's implemented innovative models of self-directed nursing care for home care residents that includes both skilled nursing care and personal care examples. But there are many good examples in the US, and I'm sure those of you in this room could describe many such innovations and tell the stories of those they help, so send them to me. But as you know from Glenn Steele, I serve on the Geisinger Health System Board and the Geisinger Health Plan Board. Geisinger has a medically complex model that uses care teams with a nurse and a community health assistant to treat elderly patients with complex conditions. And each team visits patients in hospitals or skilled nursing facilities to arrange post-discharge home visits. And when the team makes those home visits, they assess overall health, nutritional support, patients' medication management needs, safety in the home, level of support patients receive at home. And during a 9-month pilot, care teams have closed an average of 14 gaps in care, such as medication adherence, and 3 safety-related gaps per patient, such as hazards in the home. I have a wonderful colleague at Johns Hopkins, geriatrician Bruce Leff, who developed the hospital at home model of care with Hartford Foundation support. And one of the sites that's implemented the hospital at home model is Presbyterian Healthcare Services in Albuquerque. Under their model, they allow patients who meet the criteria for an inpatient level of care who would traditionally be admitted to the hospital to receive care at home. Patients receive daily visits from a physician or a nurse practitioner, 1 to 2 visits daily by a nurse, and their early findings are that patients are better able to resume their activities of daily living after discharge compared to hospitalized patients. They have a third of the readmission rate of the national rate. We also heard a little bit this evening about Anthem, which has a Care More, which is a senior-focused healthcare delivery program that includes Medicare Advantage plans and clinics designed to deliver proactive, integrated, individualized healthcare. Their mission is to improve the overall lives and well-being of seniors by providing innovative, focused healthcare approaches and getting very exciting results. Just had some information this evening from Peggy O'Kane, who was just at the National Committee for Quality Assurance, who was just out visiting them last week. I'm currently working with Quincy Samus and other Hopkins colleagues on a Center for Medicare and Medicaid Innovation Healthcare Innovation Board. It is testing a maximizing independence at home model of care for supporting people with Alzheimer's and other dementia in the home. An early pilot found that this model of care has reduced or delayed nursing home placement by 110 days at a savings of $26,000 over 3 years. We are developing under the award a payment model with a blend of monthly care management fees to cover the services of memory care coordinators that assist, in this case, dual eligibles and caregivers in the home who are supervised by a team of geriatric psychiatrists, nurses, and occupational therapists. And this payment model provides shared savings from reduced or delayed nursing home placement. When we think about shared savings, we typically are talking about the Medicare benefit package, which doesn't include long-stay nursing facility, but shared savings from delayed long-term nursing home placement and providing those savings, sharing those savings with the organizations that provide home and community services. So I'm very excited about that. But that's one small project. And in my view, just as the centers on Medicare and Medicaid services are now implementing and monitoring the impact of accountable care organizations, we need to think ahead to the next generation, which is looking at complex care organizations, ACOs, moving them to becoming CCOs, to generate evidence on which beneficiaries can best benefit from a complex care benefit, the type of organizations and the requisite qualifications that are best needed to serve as CCOs, the appropriate type of services offered, beneficiary, caregiver, and provider incentives and responsibilities, performance metrics on quality outcomes, and cost impact of a new form of care delivery for beneficiaries with complex care needs, where the overriding goal is to help people maintain their independence and avoid nursing home placement. Certainly, there are significant unanswered questions about the cost, savings, and financing, but I think accelerated testing of the CCO concept is important as population aging will lead to a rapid growth in the number of beneficiaries with complex care needs. And beginning with those living at home and implementing promising models of care delivery that enhance the ability to live independently is urgent to assuring both quality of life for Medicare beneficiaries and avoiding rapid growth of costly institutional care. Extensive testing of interventions and developing Medicare and Medicaid payment models that support the spread of successful interventions that improve quality of life for beneficiaries and caregivers is the important first step. But thought also needs to be given to financing, the stumbling block that has thwarted progress in the past. Realistically, such a benefit is likely to cost more, just as it costs more to cover prescription drugs under Medicare, it costs more to cover the uninsured. But some funding can come from affordable premiums and co-payments for modest and higher income beneficiaries. Such funding could be combined with new revenues. I had a chance to chat with some of you this evening who are working with the Social Security Advisory Board, experts on SSDI. But whether that's an increased share of earnings contributions over the working years, changing the income threshold for SSA contributions, earmarking estate tax revenues, which is something we used to talk about, or restructuring SSDI and Social Security financing to ensure both the long-term fiscal viability of income support for SSDI beneficiaries as well as home and community care for Medicare and SSDI beneficiaries. The way forward is going to come from you in this room and your colleagues all across the country who are working right now to identify gaps in care, build new integrated health and long-term services and support models of service delivery, and refine ways to evaluate and compare performance. I'm confident we will, as a nation, continue to rise to the challenges that confront us, and we will, sooner rather than later, achieve the vision of that high-performance health and long-term care system that guarantees affordable and comprehensive health insurance coverage and high-quality, safe care that respects the universal human desire for independence and autonomy. As Hubert H. Humphrey said, the moral test of government is how that government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick, the needy, and the handicapped. Thank you very much.
So before I have the honor of presenting the Robert and Ball Award to Karen, I just want to take a moment to acknowledge someone who, for the past 3 years, has given the Academy tremendous leadership as our president. He's been a tireless and fierce advocate of necessary changes in the Academy structure, a new strategy to meet the challenges we face, and I think we really owe him a debt of gratitude. So Larry Atkins, just please stand and thank you for what you've done for us. I think it's very appropriate that we're having this year's Robert and Ball dinner just 2 days after Father's Day. And I hope, on behalf of all my fellow fathers in the audience, that you all had a very good Sunday. For me, it was a very revealing Sunday. My daughter, who's a millennial, I notice we have millennials in the audience, which is very good for the future of the Academy, because one of our missions is to inspire as many of you as possible to become advocates and specialists and champions of social insurance. So I know if you can relate to this, my daughter informed me of something. I think I have an obligation to tell all of you fathers. There's a social media trend out there. It's called Dad's Bods. Have you heard of this? Yeah, well, just so that you know, what my daughter said, we're being encouraged to take photographs of our fathers at the beach in nothing but bathing trunks, at barbecues in nothing but shorts, and post them on Twitter and Facebook and the like. So when I heard that, in my most fatherly, gentle way, I said to my daughter, Allison, don't you dare. But if you must, I beg of you, do not tag the photograph as my father, William Arnone, chairman of the board of directors of the National Academy of Social Insurance. So I want to warn you, if it is out there, I tried my best to, because a piece of me thinks that we'll get more tweets and Facebook likes than ever in the history of the Academy. I'm just dreaming. I think all of us in this room view Bob Ball as our father. I'd like to think that his most important legacy is this body that we're all part of, the National Academy of Social Insurance. I'd like to think that he would look at us today with fatherly pride. And I know, even though I didn't spend as much time with Bob as many of you, I can recall vividly how he could be stern and soothing at the same time. He could be soft-spoken but hard-nosed when need be. And Bob was the most authoritative person I ever knew in the field of social insurance, and yet with all that authority, he could spend time with neophytes, educate us, inspire us, and do it with patience. Never let us feel that we were as unknowledgeable as we were compared to him. So I guess to that extent we felt like members of Congress, and that he always made us feel smarter. So I think we're all Bob Ball's children, and I hope, I'm just envisioning Wikipedia in their revised Bob Ball bio saying he fathered hundreds of social insurance experts. But I do think that really is what I hope Bob would view this as one of his proudest legacies. So the award in his name, it's my honor to present it this year to Karen. Before I do, I just want to acknowledge, as Karen did, the presence in the audience tonight of half of the former Bob Ball Award winners. So I just want to acknowledge them and ask them just to stand up and take a well-deserved bow. And this is in order of their winning the award. So Steve Goss, Henry Aaron, John Rother, Bob Reischauer, and Alice Rivlin. So you are members of a select group, and your newest member adds even more luster to that wonderful group. So Karen, if I could ask you to come up here and let me present you with this award. And now to lead us in a toast of our honoree, David Blumenthal. David?
Well, that was vintage Karen Davis, her talk. It was passionate and analytic and future forward-looking, and I suspect maybe even predictive of where we may get at some point in time. So Karen's name is now inscribed in the annals of the Robert M. Ball Award for Outstanding Achievements in Social Insurance. I think I speak for everyone at the Commonwealth Fund, and I think I speak for everyone in this room in saying that we're grateful all days, every day, for the contributions you've made in your career and will continue to make. And we're delighted collectively to congratulate you on being the recipient for the 2015 Robert M. Ball Award. Karen.